Gail Holcutt, Gailhoucutt.
And why don't you tell us a little bit about Jazzy, when you first encountered her as a patient and what she needed care for?
So when Jazzy came to us, she was incredibly sick. She had been at another hospital prior to coming to us, so was already on a breathing machine, and it wasn't very long after she arrived here that we decided she needed to have ECMO support, which was the ability to allow her lungs to rest. So hours after she came here, and it took us a little while because she needed special blood. So hours after she came here, we placed her on ECMO. And at that point in time, she was completely sedated and paralyzed because she was so incredibly sick. And so over the course of ECMO support, we allowed her over that 20 days to wake up, to be involved in her care, to do occupational therapy, to do physical therapy, and it allowed her recovery once she came off ECMO to be that much quicker, so she could go home much sooner.
Is that typical for pneumonia to end up on ECMO?
No, it's not typical for pneumonia to end up on ECMO, but she also has sickle cell. So she had another underlying disease process, and so sometimes you can get such locked lungs, which essentially is what happened. She had lungs and actually even her chest cavity filled with fluid. So using a ventilator to push against her lungs was one of the worst things that you could do at that point. It was better to allow her to be able to rest. And so by supporting her with ECMO, we were able to put the ventilator down to very low settings and allow her lungs to heal. So ECMO is extracorporeal membrane oxygenation. That's what it stands for, and it's essentially blood outside of the body. By taking blood outside of the body, we run it through a machine that actually does the gas exchange that your lungs would do. So for her, we were doing the work of her lungs.
What does that feel like for a patient?
I have no idea. I know that, we did have an older teenager. I think they can feel that in their chest. So there's a cannula, which is the mode that we do the blood exchanges, that goes in through a vein in their right neck, and it sits in the heart chamber. And there's exchange of blood. So we return oxygenated blood and we drain deoxygenated blood and let it go through the circuit and get reoxygenated. So she sat up. She could sit up and dangle on the side of the bed, and we just supported that. And we've had patients that we've actually walked with on ECMO that weren't on breathing machines. And so it's new, really. It's new for us here to allow the patient to wake up, to allow the patient to be more interactive. And we're seeing such great results from it because then their time after they come off of the ECMO circuit is much briefer as far as rehabilitation in the hospital.
How many days was Jazzy on?
She was on for 20 days.
And how does that compare to the average kiddo? Or is there no real comparison?
Well, it really depends on what they're on for. And so because she has a little more complex history and she had a lot going on in her chest, it was a bit of a long run. We say 4 to 6 days for most bacterial patients, a viral 2 to 3 weeks, and she fit more in that panel of a viral patient of 2 to 3 weeks, really, because she was almost on 3. And every day we talk about it. Where is she? What do we need to do? Where can we go? It's not something you want them to sit on for forever because there certainly is risks involved, but what you want is for them to recover and start opening their lungs themselves instead of forcing them open, and then remove the ECMO support, and then hopefully remove the breathing tube a couple days later. And that was pretty much what happened with her, was she healed so well, and we allowed her to rest long enough so that we could just take away that support.
Would you call her a success case?
A very success case, yes. She was dancing around her room. I mean, that's what helps us, inspires us to do the work that we do, because not every patient that we put on ECMO survives. I mean, they're the sickest of the sick, and we know that. But we love the success stories, and to watch a little girl smile and dance around the room and know that she's going to go on and do wonderful things and have a great life, that's the reward for that hard work, because it's hard work.
You can tell that you're passionate about Jazzy and your other patients. What does that mean for you personally, to see a little gal off the machines, dancing her way out of
The
Riley.
hospital. It's why I do the work that I do. It's the reminder, and that's why we love it when those patients come back. You know, we have the walkathon coming up pretty soon for it's CV and the ICU walkathon, and a lot of our ECMO patients come back to that and walk. And you just look at them, and usually the only thing that we have that would show that they'd ever been on ECMO might be a little scar on their neck.
And in the state of Indiana, if a kid is sick enough to need to be...
We have a pretty big referral area. Sometimes we get patients even a little from Illinois, from up in northern Indiana for sure, Fort Wayne, South Bend, a little bit down into Kentucky, but we do have neighboring ECMO programs in Cincinnati, in Louisville, Kentucky. Not so much in southern Illinois, so sometimes we do get some Danville, Illinois, even patients over this way. So. She was very mature for her age, and that's what allowed us to be able to let her wake up and not be sedated. And she would cry sometimes. I mean, you could see that she was upset, but she listened, and she wanted to get better. And I actually went to the dollar store and bought her a little princess mirror so she could see the things that she kept touching on her face. She had a feeding tube in her nose, she had a breathing tube in her mouth, and she wanted Adam with her hands. And when we could explain to her what those were and what they were there for, it helped her understand and leave them alone then, instead of mess with them. So
Is it a good dollar spent?
it was a great dollar spent. Yeah, it was. I would bring it in for anybody, and it was princessy, so it was sweet because she was a little girl. Yeah.